welcome back to another episode of Kate and Isaiah Living Large. I'm Isaiah.
And I'm Kate.
And on this episode, we are going to talk about a CBC article that came out, about a study that basically talks about avoidable deaths and how New Brunswick has the higher than average avoidable deaths in Canada.
Yeah, we're number one.
Number
one.
In something. We got to be something, right? So yeah, we're going to talk about that in a moment. But before we begin, what's new? What's the haps? What's going on?
Well, I've been battling a head cold, so I sound a little bit raspy, but you know, I'm on the mend and that's great. But last week I opened for James Mullinger last Friday, and what an incredible experience. Just like it was a sold out crowd, and the crowd was hot. Like they were just ready to laugh.
Nice.
And I think because I was just trying to not snot all over the microphone or something, or have a horrendous coughing fit, I got out, I wasn't as nervous as I could have been otherwise, because I was so focused on that other thing. And so I was able to relax a little bit, and like even a couple of fumbles, like the microphone, I couldn't get on right away. And I was like, hello, everyone. Can you hear me? And then I did inevitably cough through a part of it. And then I came back on, and I made a joke about that, about like, you know, it's fair. In all fairness, this cold isn't really that bad. I think it's more of a man cold where it's not that bad, but I just want everybody to feel bad for me.
Nice.
And so, you know, it just was, and James is always so wonderful to work with and be around, and so positive and uplifting, and it was just really a great time. And great to see so many people out, and so thankful for the people who showed up for me. Thank you, Terry, for coming out, and nice to meet your daughter, and nice to see my boss out and her husband, and just like,
you know who wasn't there? This guy.
I've told you when you need to show up, March 21st.
Listen, me and Andrea talked about it, and we think we can just donate $5 to Jesse and not have to go.
Please come. It would mean a lot.
Speaking of March 1st, what's March 1st?
March 21st.
What's March 21st?
I'm going to be headlining my very first show. And it will be in support of Uptown Fridge. It'll be Bad Words for a Good Cause. And so $5 from every ticket sale will go to Jesse with Uptown Fridge, who is raising awareness and money for food insecurity issues in St. John area.
Yeah.
And he has very generously said he's going to match every ticket sale with an additional $5 of his own money.
Crazy.
So like, that's like $10.
A whole $10.
And plus you'll get to see my debut as a headliner.
That's true.
Which will be kind of exciting. And the lineup is shaping up. And there's some pretty cool people who've already agreed, and some things that may or may not happen with it, but like it's going to be a great time. Nice. However it goes. Nice.
I got to see a Uptown Fridge sighting today.
Oh yeah. In real life?
Yeah. He walked.
Were you the deer?
Yeah. He walked by the house. I tried to run out and catch him, but he must have had headphones in and
couldn't hear me. Sad.
I took a picture of his back though.
Did you send it to him?
I posted it on Facebook.
Oh yeah. Spotted. XOXO Gossip Girl Isaiah.
Yes, Gossip Girl Isaiah. What else you got coming up? So that's like March. I say March is a ways away, but it's not literally around the corner.
Yeah, I've got lots of stuff coming up before that too. This weekend I'm going to be in Fredericton Friday and Saturday night at the Comic Sutra, and part of a year in review comedy show, which will be co-hosted by Kelly Lamrock and John LaRue. And I'm going to be a special correspondent.
Ooh.
Talking about my 2025 in the world of dating.
Yes, the world of dating in 2025, and the BBW Cupid or whatever it was called.
Oh yeah, BBW Cupid. I forgot about that. Actually, I'm going to rail on that, and I'm going to talk about my Ryan Wedding.
Okay.
That snowboarder.
Snowboarder
turned drug lord.
Well, you know, everything's white.
Millennium success story. Millennial success story.
Very few of those.
It's true.
That's next Friday. Oh, this Friday coming up.
Coming Friday and Saturday. And
What else you got?
in February, there's a Ridiculous Comedy Festival. And I'll be opening for James Mullinger again, and now and in a now sold out show.
Nice.
And also going to be on another show called The Nice Guys or something. I'm hosting that one, and it's going to be like a 4 p.m. on a Saturday.
Oh,
and all of your
my favorite time.
Your good friend Matt Keenan will be on that show, so
so we'll go to that one.
Surprised if you show up and avoid every part that I host.
We'll just leave as you have to get up and host.
You just conveniently have to go to the bathroom every time I host.
Yeah,
take up smoking.
It's a habit that has to be formed somehow. So
yeah. Speaking of smoking, what's up with you, Isaiah?
Thanks. The segment for me is speaking of smoking.
No, I was going to launch into a topic, and then I asked you nothing about yourself, and I didn't want to be accused of being a hog.
Oh, it is your show.
Oh, it's my world.
Moving. You might see some clutter behind us. With my stuff's kind of being condensed. You might see some books shelves missing if you're watching on YouTube. So slowly moving some stuff around. Getting prepared for our new space.
Yeah. And that's the only reason he's moving.
Yeah. That's it.
Own a house and
we need to expand.
Run a house.
We need to expand.
It's really just about the podcast.
We need to expand the podcast. It's time.
He's uprooting his whole life.
It's time. So, we're getting too big. We need.
And not just us personally. We're actually working on that.
Other than that, it's winter time. So working away, been jumping in the pool, doing some laps every so often, trying to get fit. But
nice.
It's the same old right now. I'm on 17 movies watched. What day is it? We're 19, day 18. Is it today's recording? And
what was your goal again this year?
200.
Oh yeah, you're in good shape then.
I'm doing all right.
Because I'm assuming there'll be a lull in the summer.
Probably.
So you gotta beef up now.
Yeah. If I figure if I can be roughly around one a day, now, when the summer lull comes, I
get so behind on TV shows.
I watch TV shows too. I've been watching The Pit. Have you watched The Pit yet?
No, my sister's all into it.
Oh, so good. I can believe that your sister would be into it. It's great.
I just watched just today in one sitting, His and Hers. It's one of those Harlan Coben short series.
No.
It's a very good movie, or very good mini series.
Yeah. You know what also came out on today of recording? The new Game of Thrones TV show comes out today.
That is something I'm not interested in.
No, I'm quite interested. But let's get into our topic. Let's talk about our topic. Avoidable deaths on the rise in New Brunswick.
And so this was interesting to me in that avoidable death is not necessarily related to obesity, and they actually didn't pull out obesity as one of the contributing factors in the article, I don't think.
No, I didn't see. They alluded to obesity being a factor.
Yeah, and it is in a lot. And so they talk about these 6 avoidable deaths. And the reason they're avoidable is because there are external factors that contribute to them. And they include lung cancer, heart disease, colorectal cancer, diabetes, stroke, and chronic obstructive pulmonary disease, or COPD.
You said it like I say it all the diabetes.
Like Wilford Brimley.
The diabetes.
Diabetes. And I usually call it the beaties.
The beaties.
And so a lot of those we have talked about in the past are ones that obesity are contributing factors to. So we kind of thought, oh, good, New Brunswick. Perfect.
Number one.
We're number one. Or I don't know if we're number one, but we're certainly
top. We're topping it.
We're top tier.
We're in the top percentile, that's for sure.
And so we thought we'd talk about what is it about New Brunswick that makes it so, and there are lots of contributing factors. One of them is that we are one of the most obese provinces.
Yeah, I mean
that's been reported in the past.
Yeah, we are it, and like you said, a lot of those things are obesity contributes to a lot of those things, right? Especially heart disease and diabetes. Like those are very high factors when you're obese.
100%. And then the other one of the main contributors to a lot of those is smoking.
Yeah,
And there's some of the highest rates of smoking still in New Brunswick.
for sure.
Which, you know what's funny, and it's a little bit of a tangent. We've all been around there in New Brunswick. When the smoker goes out for a cigarette break, they kind of consult all the other smokers in the room and make this whole new social construct outside.
Yeah.
And they're like, "Hey, I'm going for a smoke. Want to go for a smoke? Let's go for a
Let's
smoke."
go for a smoke.
And then half the crowd leaves or whatever. And those numbers have shrunk over time, but it is an interesting social dynamic. But when I lived out west, and I'm not talking like I lived in Vancouver when I lived in BC, I lived in Fort St. John, which is a pretty rural and blue collar place. People would like subtly sneak out on their own, smoke their cigarette, and come right back in because the social activity was inside. And even if there was another smoker and they knew there was another smoker, it was a quick sneak out, fill their urge, and then go out back at it.
I found when I smoked, I don't smoke anymore, but when I smoked, especially at work, it was a big equalizer. And that was the one thing when I stopped smoking that I had a hard time with, was because if your boss smoked and you went and smoked with your boss, that was time that you were basically equal, and you got things and potentially had build relationships that didn't form if you didn't do that.
Right.
And that was a big thing when I quit. There's
whole episodes of sitcoms about that. I think there's an episode of Seinfeld that touches on that.
Probably.
I forget. I think it's Elaine takes up smoking to
to be that.
Yeah. And the other side of that too is nobody questions a cigarette break.
This is true. This is very true.
Everybody a smoker says they're going out for their cigarette and nobody anticipates it. Having said that, I have not noticed in my job anybody regularly going out for cigarette breaks.
I think the stigma is higher now of smokers, right? It used to be that no one really thought about smokers. It was just everyone smoked. I think now there is a stigma behind being a smoker a lot more.
Yeah.
And so people that smoke
are quieter about it.
Quieter, but like you said, at West, people will sneak away. I think more people sneak away now, not at bars. It's like, I'm going for smoke. Are you going for smoke? But I think at work, I think I slip away and I smoke and I come back. I think that's a big one now. It's specifically in work environments, not necessarily in other social environments.
And I don't think it's all work environments.
No, God, no. I mean, if you work construction, I'm sure those guys, a lot of those guys still smoke a lot.
100%. So Isaiah very handily marked out a few threads to pull at for this episode. One of them is when your postcode ChatGPT wrote all that.
Yeah, it did.
That makes me sad.
When your postal code affects your survival. I mean, so in the article, it's funny because in the article it talked about how, and specifically called it like places like Campbellton and things like more rural New Brunswick.
Also more aged. There's a much higher, much older population there.
And then Russia Gornish was another one they
which is bizarre. Like that one is not far from Fredericton to not have access,
but far enough that
no further than Hampton is from the regional.
But it is and it isn't. It feels like, I don't. For me, when I've ever up in that area, it feels a lot farther.
Yeah, but it's not.
I know, but if it does feel,
it's just not though.
No.
In terms of being able to get to the hospital.
Yeah,
although
I guess.
I know that the deck has its issues as a.
Yeah. But I think a lot of rural places have, like, there's not necessarily, well, I guess a hospital deserts for lack of a better term that I couldn't think of, but basically, there's no one there to really treat people in that space, and they have to go farther, and the farther you have to go, the less likely you are to seek help and survive and all the other stuff, right?
And it's such a funny thing because we're part of the issue is that we're such a small population province too.
True.
And so we can't actually support the number of hospitals that we even currently have, as evidenced by them having to have shutdowns and things like that. We just don't have enough healthcare workers
Yeah.
to support it, even support the big three hospital, like the big three cities, let alone every single one in every single community. And so governments have been struggling with this for 20 years, and it's very not a good political decision to try to shutter a hospital anywhere. Sussex or Perth, Andover, and it doesn't go well for you politically when you try to make those hard decisions. And I'm not saying they're right or wrong decisions. I'm just saying the way things exist currently can't be sustained.
Yeah, no, totally. That it's an interesting dilemma when it comes to that, and there's something to be said for small clinics existing in rural towns.
Right.
Not necessarily hospitals, but like funding small clinics to like see people on a regular
100%.
basis. And like, again, we're talking about avoidable deaths, right?
And I guess that's what brings me to the next point is, the hospital care, when it becomes urgent, that is a factor in terms of whether you're going to survive or die. But with these avoidable deaths is kind of stuff that needs to be nipped in the bud much sooner than that, which actually makes a greater argument for family doctors or equivalent, like a nurse practitioner or whatever that is a regular care early on. And there's a real shortage of that.
Yeah, I think when I think of funding, I think, yes, funding the big hospitals is important because, we need those like trauma centers.
Yeah.
But at the same time, when we talk about helping, if there's a shortage in those trauma centers, a big way to prevent having to fund more of those trauma centers is to do the preventative measures to begin with.
And everybody knows that. Like and not everybody. I'm not like, I say everybody knows that. That's not what I mean. Like, but all governments know that. All healthcare workers know that. And they know where the problems lie. And the problem isn't even a financial one in that regard. It's a recruitment issue.
That too, yeah.
And it's not just a New Brunswick issue.
Yeah.
I don't want to beat up the old New Brunswick government for something that's happening across the country and around the world. Like, I guess the US is different because there's the paid healthcare versus whatever. We're not going to get on that debate. But there's real issue with that here, but also everywhere.
Yeah.
And it is one, and like I think you kind of brought up, like part of it is people will avoid going to the doctor at all costs.
Yeah. So that doing the steps to prevent the unavoidable the avoidable deaths, such as stopping smoking or going to see a doctor. And some people don't go see doctors because we've talked about it a million times, right? It's, they're just going to tell me it's my weight. They're just going to tell me
quit smoking.
They're
just going to tell me it's this. And they probably will tell you some of those things in certain cases.
Yeah.
But if they're not, because it's their job, like, especially with smoking, that's a very challenging issue. Like, it's a pretty cut and dry that smoking is bad.
Yeah, for sure. But I think that the avoidable part of it is, smoking's bad. They're going to tell you to stop smoking. But if you are a smoker, catching lung cancer early can help with the avoidable death later, right?
100%.
So getting those things caught early on in the treatment cycle helps your survivability go up
100%.
So
and there are other factors too that they mention in New Brunswick, like radon being one.
Yeah, we don't do a lot of radon like testing here.
No, didn't you see the huge campaign?
We start doing it now a little bit more, but
there's like a huge radon testing campaign right now. There were tests available through the public library system.
Yeah, because I know it was out west. They do like they have like radon shielding that they put in their basements and stuff.
Yeah, well, my sister has been doing the radon test that she picked up from the public library, and it's almost done her 3 months or whatever. And I said, "What do you do if you find out there's a lot of radon?" She's like, "I don't know."
It's so if I'm and I clearly not super educated on it, but I think it's literally just plastic sheeting that you can put down
in
the flooring that like prevents it from leaking through.
Okay, so you have to lift your floor though.
Yeah.
So it's an expensive job.
It's an expensive job, but it's like literally a plastic sheeting that
Cool.
goes down. It's it's an interesting because
And it comes up from the ground?
Yeah, it comes out of like the soil and specifically rocks, like a rock formations. So the rockier your, again, not 100% sure on this, but from what I understand, the rockier space you have, the more likely radon exists in that area.
So if you live on the east side of St. John, you're fine.
yeah. If you live uptown, you might have radon.
Yeah. Grand Bay probably have radon.
Probably, yeah. So yeah, no. If you live in the swamp, you're probably okay.
Yeah, if you live next to Kent, you're probably fine.
You got other issues, but
you're gonna sink into the ground. But like,
but yeah, from what I understand, that's kind of, it seeps up through minerals in the ground, and specifically, it's more likely to exist in hard rock areas.
Yeah, interesting.
Yeah.
You should listen to more country.
But
that's such a dumb joke.
So bad.
What else can we talk about on the avoidable deaths? What else do you have up there? I think it's really interesting to talk about like geography, the geography of Brunswick, the population, aging population is obviously a thing too. Lack of primary care. Primary care is the word for family doctors. Yes. Yeah, that's the one. That's
the word. Yeah, I think the lack of the primary care one is a huge one in New Brunswick. It's huge everywhere, but like it's very, very huge right now.
Because that is one of the things that like you say, nip it in the bud and constant work and like.
Yeah. And I mean, the thing about having like a primary care doctor is then they truly take a look at your family history and see, oh, your family has a history of XYZ.
Yeah.
Let's get you tested for XYZ. Those things. Right. So,
yeah. Well, it's very interesting.
It was an interesting read. It was an interesting, like it wasn't that long, and I'll make sure I post it in the comments, the description section. So if you want to read it, it just kind of the article really just talked about how we are in the top percentile and certain factors, right?
Yeah, so. it was interesting, especially in relation to some of the topics we've already talked about, because a lot of the avoidable deaths to a contributing factor can be obesity in a lot of these cases.
Yeah, for sure. And I mean, again, we always encourage you to get yourself checked and try and make sure you keep your health in mind.
It's important. And that goes for both of us too.
Yeah. Right. You know, we always try it. We always talk about avoiding it too. We avoid it.
We're both avoiders.
We are both avoiders.
Like I know that I have blood work that I have to get done, and
yeah, but I think normalizing the talk of the fear is a good way to have a conversation about it and help people go more.
Yeah,
I think just normalizing that. Yeah, people are afraid, but you still got to do it, right?
Yeah, 100%.
All right. Where can people find us on the internet?
Find us at Kate and Isaiah Living Large on Facebook. And where can they find you?
At Maritime Brews on all the social medias. Of course, we have the Buy Me a Coffee going. We're still working on that mic. We're working on that Shure mic, these lovely Shure mics.
How much do they cost, Isaiah?
Oh, they run depending on if there's a sale on. Usually they're around $180, but they can run up to $220. But we try and get them on sales. So. Yeah, we're working on
180 to 220. So we're looking for $200, and we've got some money in the kitty. Thank you for all those who've contributed.
Heck yeah!
And soon we'll have guests again.
Yeah,
probably when we're in
a new space and a bigger space.
And
we won't be all jammed together. And
we're glad to see people.
Yeah. Other than that, if you're listening on wherever you listen to your podcast, if you can like, share, subscribe over there, or hop on over to YouTube. And if you're on YouTube, you can like, share, subscribe over there as well. It goes a long way to helping out. We definitely appreciate everyone listening. And until next week, bye.